Thank you for coming today. This is basically not cool right there. I'm a senior sport management major, and this is my exit exam. So it's on personal training. It's a needs assessment of a program for Wingate University. A little introduction, just a point, how important do we feel fitness is in the United States? Obesity rates are continuing to soar in our country. Between 1980 and 2000, obesity doubled among adults. 60 million adults, or 30% of the population, are now obese in our country, and more than 50% of adults don't get the recommended physical fitness that they need to get health benefits. Along with adults being obese and not getting enough physical activity, their children in the United States are becoming obese. 90 million children over the age of 6 years of age are considered obese today. And with obesity and health problems is like things such as diabetes, health disease. We really want our children growing up in a society that doesn't take fitness as importantly as we should. And why are obesity rates so high in our country? What steps can we take as a university to provide programs so that we as a community are not becoming another statistic? So that basically brings me into my research presentation, and it's on personal training here. Okay, my purpose is to survey students' interest in a personal training program here at Wingate. And secondly, can a personal training program be incorporated as a minor in the School of Sports Sciences and into our curriculum? Beneficiaries. The School of Sports Sciences, obviously, if we have another program, we can bring more students into our school. And if students have an option of making personal training a minor, they can become certified while focusing on other classes, so they can have another major but minor in personal training. So if a student is interested in fitness, they can actually get this benefit of this program and have a certification when they come right out of college. Campus rec, if we're offering a program, of course we're going to be doing it in DPC, certifying students and having students come in and out of there getting trained. So we would definitely be utilizing that facility, and there would be possibly a GA position open. Maybe the person that's certifying the students can be the GA position, so that can fill another spot for them, and also students and faculty bettering their overall health and fitness. Strengths of this program. Like I said, bettering their physical fitness for students and faculty. So that's very important. In personal training, personal trainers, and group fitness can help. So if you want to work one-on-one with the trainer, or you want to work in a group setting, hopefully we can offer both of those. And it can really be a good option for students and faculty. And certified students can seek employment directly out of college with an accredited certification and valuable experience. So if they're certified here at Wingate and they're getting experience with other students and faculty, they can actually come out with a good amount of expertise, hopefully, in their own field, and they can actually hopefully get a job rather than someone that just got certified and they're trying to go into a fitness setting and get a job. With experience, hopefully you'll have a step up with that. Weaknesses. Limited equipment and space available in the DPC. We all know it's a small area. And also the personal training curriculum. We need an instructor to teach the certification class. There's no one available right now. If we could get personal training and group fitness. So we need someone who's accredited to do that. Opportunities. It may increase enrollment in the School of Sports Sciences. As I stated before, it can attract new students to the school because of the program and services that we offer. If we think about our competition such as Catawba or LR, they offer a lot of the same academics and majors. They offer sport management. They offer sport physiology, I believe, yeah. And the student may choose us because of this extra program. If they really have a passion for fitness, they can say, oh yeah, Wingate's offering a program where I can get certified as a personal trainer. Why wouldn't I go here rather than my competition? They have a step up with this program and they're offering more to me, so why not go to Wingate? So hopefully they can look at it that way. Threats. Local health clubs, and the main one is the Monroe Aquatic Center, right up the street, right across the street from Walmart. The DPC currently has a limited number of cardiovascular machines and strength training equipment. Even after our current renovations in the past couple years, we're still lacking a few things in that area. And if we really want to have a program like this, we would really need to utilize the little space that we have, getting people in and out of there smoothly, as well as students who want to come in there and lift on their own. We need space for that. Not saying we need to increase the space, we just need to utilize the space that we have so people can come freely. And our competition offers over 100 pieces of cardiovascular equipment, 3 different aerobic rooms, and many different group fitness options. So how can we compete with that? They offer wide variety of options for people. Background information. I collected different information on certifications available. I interviewed 8 different personal trainers, and I surveyed students just to see their interest in this area. These are the top 5 different certifications as of currently. The first one is the National Academy of Sport Medicine. It takes current research and the current states of a client to create a certification more relevant to today's profession. Number 2, National Strength and Conditioning Association. It focuses on keeping basic fundamentals of strength and conditioning intact. These can be strength and conditioning specialists, those who work with college athletes, pro athletes. So this is a number 2 certification. And since it's number 2, it requires a lot of rigorous recertification processes. I think it's every couple years they have to go in and get tested again just so they can be ready for whatever comes at them. And it's the hardest exam to take, so we wouldn't go down that route to get certified in that area. Number 3 is the American College of Sport Medicine, and it's the most respected certification, but it tends to focus more on clinical sides of personal training, so it can be working at a hospital with patients like in cardiac therapy and stuff like that. We wouldn't really go down that route either. Number 4 is the ISSA. It works with youth fitness, senior fitness, and sport therapy and performance nutrition. Number 5 is the ACE. It has a reputation for being a standard certification, become efficient in fitness assessment, nutrition, exercise science, and exercise programming. And lastly, the other one, when I was interviewing my personal trainers, it was the one that came up the most, but it's not under the top 5. It's the National Council of Strength and Fitness, and it's recognized nationally, and it integrates science and research with cutting-edge training techniques. I surveyed my students, and these are a few of my results, just a few questions that I asked them. I surveyed 60 sport science students, and 57% of students have an interest in becoming a certified personal trainer while at Wingate. 63% agreed they would possibly minor in personal training, and 77% of students said they would use the services if they were available in the DPC. So it's over a majority for most of them. So I feel like that was a good number. Recommendations. I recommend that we offer the ACE certification and the NCSF certification. The NCSF already has a college course available, so for us being a new program offering, if we can use something that's already set up for us, it could really be a good option for us. The course emphasizes the academics and the hands-on skills required of the most successful practicing professionals. You can effectively certify students in 32 hours with interactive lectures and practical hands-on training. And also the ACE offers personal training, certification, and group fitness instruction. We could bring a wider variety of options for students and those using the DPC, and the NCSF is perfect for those interested in strength training. I recommend that our certification be a 3-hour credit. If you can do that in 32 hours and then take your test after that and actually get the certification in, I feel like it could be done in a semester, and have a 2-hour practicum, students working the DPC, just helping out, showing people how to use equipment, and possibly helping train people, not getting paid yet. And then I recommend that Wingate require an 18-hour minor for those who wish to minor in the field. And I say that the minor should look a little something like this. Anatomy and physiology is important. You need to know how the body works and how it moves. Nutrition is important. Kinesiology, maybe a 3-hour elective, and as I stated before, 3-hour certification and 2-hour practicum. little reflection. A personal training program is something the student body and faculty can support. The program can offer more to current students and faculty. It can be a good recruiting tool for incoming students and can positively impact the future growth at Wingate. Any questions? Okay.
How do most people get certification at this point? Did they do it through a minor, or do they do it through one of those organizations?
It's not really through a minor, but most people usually have a kinesiology background. I know someone that I had my internship with, and she actually is a kinesiology major, and the courses that she took she actually went to Penn State. The courses that she took there prepared her to do a ACSM certification, the more clinical side, and she works in Pinehurst, right beside Moore Regional, and she's doing that. So I feel like it sets you up for a good career in personal training and fitness, if that answers your question. So I feel like if we would offer this program and have students take these classes, it can set them up to go in and take the certification and pass with flying colors because they already have a background and everything that they'll need for personal training. Any other questions?
I have a couple questions. Two questions. What elective would you recommend they do?
It would definitely have to be something, I guess, biology or something, just something that had to do with fitness. You can't just go in there and take like art or anything, and it would have to be like a background in that. I wasn't really thinking further with that, but it definitely couldn't be like literature. It needs to be something relevant to the field. Yeah, PE or something, coaching.
And then the last question, why would you recommend NCSF if it's not one of the top 5 rated certifications?
Because I feel it gives a good background. Like I stated before, it already has a program set up for us. So if we really want to incorporate this into the program, if it's already nationally recognized, just even if it's not in the top 5, if that's what we're looking for, strength training, if you want to be a strength training personal trainer, it's a great program to start. And it's already set up, so it would be easy to start that soon, and it gives you a good background in that. And then the ACE could be, personal training with other emphasis and group training. So I just felt the two together would be a good fit. Any other questions? Thank you.